Well, welcome to today's video and thank you for coming back as always. It is Thursday the 16th of April. Now, there's some things in this pandemic that we haven't been sure about for quite a long time. And indeed, on this channel, we've been speculating about them for a couple of months now. Things we weren't really sure about and they're now starting to crystallise. And I want to give you some of these today. And we're going to take this from the Office of National Statistics from my country, the UK. Now, this is a very reputable organisation. I've been using their statistics for at least 30 years now. Never once found a mistake in them, to be quite honest, and there's no corruption of anything in them. They're very reliable figures. Proper statisticians. So I want to look at some of those. And I believe that what I'm talking about today is going to be true for your country as well. So I believe this is telling us now something that's fairly fundamental about the nature of the virus. Now, as always, if you don't want to watch the whole video, I'm going to give you the bottom line now. Now, these figures relate to the month of March 2020, so for the whole month of March. Now, for the whole month of March in this country, in the UK, COVID-19 accounted for 7% of deaths. So that's for the whole calendar month. 7% of people died with or from COVID-19. But by the end of March, on the last day of March, that had gone up to 28%. So we can see that in March there was a fairly dramatic increase, and we'll talk about that in more detail. Now, there's been debate as well since the start, are people dying from COVID-19, or is it just so happens they're dying when they have it? In other words, are people dying with it or from it? If they're dying from it, that means it's the direct cause of death. If they're dying with it, it means it's incidental. And this data shows that 86% of people that died from COVID-19 in March died from it. In other words, they would not have died that month if they had not contracted COVID-19. And that means that 14% died with COVID-19. So of the deaths, 14% would have died anyway. So 86% would have not have died had it not been for the COVID-19 is the important statistic there. Now, the other important one that's come out is comorbidities, the way that other diseases predispose to complications and death in COVID-19 infection. Now here, it was found in the month of March in the United Kingdom that 91% of those that died had another disease as well, a pre-existing long-term comorbidity. So 91% had another disease. In other words, 9% of people that died didn't have an underlying disease. And of the 91% that had an underlying disease, the average number of diseases was 2.7. So these are things like ischemic heart disease, hypertension, diabetes, chronic pulmonary disease, dementia. These are the comorbidities that we've talked about for a while. Now, sex. Very interesting. 61% of the deaths were men. 39% of the deaths were women. And this is on all the people that died of COVID-19 in the UK in March, so it's a large number. We'll look at the precise numbers. So men are much more likely to die from COVID-19 than women. This seems to be a conclusion now. Now, the age that people die, 87% of the deaths were over the age of 65. That means 13% of the deaths were under the age of 65. And in London, where the epidemic, or our share of the pandemic, if you like, is more advanced, where there's more cases, where the curve is at a more advanced stage, COVID-19 was associated with the deaths of 46.6% of the total number of deaths. So getting on for half the deaths in London in March were COVID-19 related. So they're fairly definitive figures, and I would expect the deaths to increase quite dramatically in April, because the lockdown in my country started on the 23rd of March, and we know there's a big lag time. So people can get infected with the virus, then they can incubate for 2 to 14 days. Normally it's about 6 or 7 days. Then they develop first symptoms. and then they have the illness, and then very often the complications occur in the second week of the illness, and death can occur in the second, third, fourth, or even fifth week after the onset of symptoms. So we have this lag effect. So this means, unfortunately, there is no doubt that deaths from COVID-19, in other words, COVID-19 is going to actually be the cause of death in a greatly increased number of people in the April statistics when we finally get them. So I think that's fairly definitive data about things we've been speculating for some time, related to age, comorbidities and sex. So that's the bottom line of this video. If you want to switch off now, do so. Of course, I'd love to give you more details as always. So do stick around for some more details and some interesting graphs and things like that. Now, as always, I'm going to paste the references so you can see it's not me making this up. So we've got the references directly from the Office of National Statistics. And I've thrown in some Chinese comorbidities for comparative purposes. We'll mention those when we come to them. So this is a completely honourable body. There's no dodgy statistics here at all. This is 100% pucker stuff. It's I believe it completely. Now, unlike other statistics that we've talked about before on this video. Now, COVID-19, it was the third most frequent cause of underlying deaths in March. And it involved 7% of all deaths for March, but it was involved in 28% of deaths by the end of March. So we can see there was a steep increase in the number of deaths associated with and attributable to COVID-19 as the month of March progressed, due to people that would have contracted the disease at the beginning of March, who therefore were probably incubating the disease and had first come into contact with it in late February, probably presenting with features in early March. And deaths due to COVID-19 was 68.5 deaths per 100,000 of the population. Now, just a couple of interesting graphs from the National Statistical Office that show us this quite interestingly. Now, what we have here is this line here, this dark line that I'm just tracing out there. That's the average number of deaths for this time period, for every day in March over the past 5 years. So that's the past 5 years. And that is all deaths this year. So we can see it's kind of slightly below average, if anything, for the beginning of March. But then a line is crossed here, isn't it? And from then on, the rate of death is increasing. So that's when the rate of death started increasing, on about the 20th of March. And our lockdown began on the 23rd. That's why we can expect this long lag period. This line here is going to continue increasing. There's no question about that. And then the deaths that were specifically associated with COVID-19, we see that they're at a very low level at the start of March. And this is exactly what we'd predicted in late February. But then the deaths started to increase. So these are the COVID-19 deaths. They've increased. And that's the increase in this line here is what's caused the increase in this line. So this line here will continue to go up, alas, during the start of April. I don't think there's any real question about that. Now, this shows the causes of deaths for March as a whole. And I am getting in the way. So this is for March as a whole. So as we would expect, Alzheimer's disease and dementia, ischemic heart disease, were the most common causes of death. And coronavirus was only the third most common cause of death. Now, of course, normally this block wouldn't be here. And we know that the vast majority of these deaths, 86% of these, were caused by the COVID-19. People died from it and not with it. So that's why the total deaths are higher. Then, as we would expect, chronic lower respiratory disease, chronic obstructive pulmonary disease, and cerebrovascular disease. Cerebro means to do with the brain. So this vascular is the blood supply. So these are things like strokes, cerebrovascular accidents. But this is for March as a whole. If we looked at this for the end of March, then by far and away, this would be the biggest cause of death by the end of March because of the gradual increase in cases throughout March. And I'll show you that one in a minute. So that was the amount of deaths. Now, going on to this debate that we've been having, I remember I've been asked this question quite a few times in interviews when we were thinking about the lockdown. If someone dies and they have COVID-19, does that mean they've died from COVID-19? Or does it just so happens they have COVID-19 at the time and they would have died that week anyway? So are people dying with it, they just happen to have it, or are they dying from it? And the example here is men with prostate cancer. So like 80% of men in their 80s have got prostate cancer. And of course, many men in their 80s die, but many don't die from prostate cancer. They might die from a heart attack or a stroke. They just happen to have prostate cancer when they die with it, not from it. So that was the question for COVID-19. Are people dying with it or are people dying from it? So this is data from March 2020. So there was 3,912 registered deaths involving COVID-19. And this is just the figures for England and Wales. Scotland collate their figures separately. Now, 86% of which had the virus as the underlying cause of death. So of these deaths here, 86% of those, the virus was the underlying cause of death. So the virus caused the death. So that means 86% of these died from the virus. In other words, had they not got the virus, they would have carried on living for longer. It's the virus that has been the immediate cause of their death. But that also means that 14% would have died that month anyway, and just happened to die, so they died with it. So that's the answer to this question we've been looking at for ages. Of those that die, 86% die from it, and only 14% of those die coincidentally with it. We've been wondering that number for a long, long time, so it's good to finally have it. And that's based on this sample size of nearly 4,000, and statistically that is a good sample size. Now, the only reason why I think these figures would change significantly, if for some reason there's a particular factor which is causing deaths at an earlier stage, because this is only for March, this is up to the 1st of April. But I don't really think that's the case. I think these are the figures. Therefore, next month I would anticipate the figures to be very much the same. If you're watching in New York, I would anticipate your figures to be very much the same as this. If you're watching in anywhere, basically, I would expect your figures to be very much the same as this, because that is a good large sample size for this virus. Of course, there's going to be variations depending on local factors, but I think that's getting near the answer now. And when we look at these next month, we can check back and see, and I anticipate that they will be pretty well the same. And this applies to comorbidities as well. I think we've learned something fundamental about the virus now because of the high quality of these statistics that we're discussing today. So comorbidities, when COVID-19 was mentioned on the death certificate. So these are people whose death certificate was mentioned on COVID-19. Now, again, there is a delay here. In the UK, after there's a death, you have 5 days to register that death. And sometimes it might not go through straight away. So there's still always a bit of a lag. But basically, these are the best figures we have at the moment. So when COVID-19 was mentioned on the death certificate, 91% of people had at least one other health problem. So 91% of the people that died, either with or from COVID-19, already had cardiovascular disease, cerebrovascular disease, chronic obstructive pulmonary disease, Alzheimer's disease, dementia, poorly managed diabetes mellitus, and of course hypertension is the other one that's often been associated with this disease. So 91%. Or to put it another way, 9% did not have another disease. So 9% of people were previously healthy, and this is regardless of age. So this is showing, again, we've wondered whether it's age or whether it's comorbidities, and now we clearly see that, well, there's an indication here that it's both. It clearly sees a bit of an overstatement. So 91% had other health problems. Now, the most common was ischemic heart disease, IHD, ischemic heart disease. Ischemic heart disease. Now, ischemia is a specific term. It means lack of blood supply. So the problem here is there is disease in the coronary arteries that supply the contractile, pumping heart muscle with blood. The muscle called the myocardium, the big thick layer. And if this is badly disrupted, if the blood supply is cut off, you'll get a condition called a myocardial infarction, where part of the heart muscle will die. So this ischemic heart disease, it's mostly caused by atheroma, this disease of the arteries, this atherosclerosis, partially closing off the coronary arteries and reducing the amount of blood that can get through to the myocardium. So that was the most common, according to the Office of National Statistics, ischemic heart disease. The second most common comorbidity was dementia, and the third was respiratory illness such as chronic obstructive pulmonary disease. Now, this is partly due to the way that the office collects their data, but we also know from China, and indeed I know a lot from talking to healthcare professionals in this country, that this disease is largely associated with high blood pressure, hypertension. And we know there's also quite a strong association with diabetes mellitus, or sugar diabetes. And I believe in the case of diabetes, but we don't know this definitively yet, that the risk in diabetes goes up as the level of control goes down. So in diabetes, the blood sugar levels tend to go up. So if the blood sugar levels go up, the level of risk goes up as well. So if you can control, if you're a diabetic and you can bring your blood sugar levels down with good control, then we assume that your risk of serious disease and death also go down, although I don't know that definitively yet. But it's looking like it might be the case. But this is the data we have from the UK, so it doesn't mention hypertension and diabetes individually, but I believe they are a factor. So, for example, high blood pressure and diabetes is a factor in heart disease and dementia. Dementia we often talk about as Alzheimer's disease, but dementia is nearly always mixed, and very often there's a vascular component in the dementia as well. Now, average number of comorbidities was 2.7, so most people had more than two. Most people that died, of this 91% that died, most had more than two other diseases. So someone might have had heart disease, dementia and diabetes, for example. That would be three, wouldn't it? So the comorbidities correlation is strong. But again, there's always the unexpected that still 9% did not have comorbidities and were previously healthy, which of course is concerning. Well, it's all concerning. But now, moving on to sex distribution. Again, this is data for 1 week up to the 3rd of April. So this is taking us slightly beyond the data for March that we've already looked at. This has been collated up to the 3rd of April, and this is for the week up to the 3rd of April. Now, in that week, there was 16,387 deaths in England and Wales. Now, that is 5,246 more than the week before. And what is perhaps more telling is that if we take this week up to the 3rd of April over the past 5 years and take the average figure, then the week up to the 3rd of April in 2020, there was 6,082 excess deaths. So this trend of the increasing deaths at the end of March, we can see has indeed been continued in the first 3 days of April. So there was this excess of deaths. Now, getting on to the sex distribution, of these 16,387 deaths, 4,122 deaths registered in England and Wales mentioned COVID-19. Now, we did look on a previous video. Obviously, this number here, 6,082, is higher than this number here. So we suspect this is the excess number of deaths here. We expect that COVID-19 has caused an extra 6,082 deaths, but that was only recognised 4,122 times. Now, two real reasons for that. One possibility is that COVID-19 is being underdiagnosed, but the other is that people who would normally have accessed healthcare facilities, for example with heart conditions or kidney conditions or brain conditions or whatever it was, didn't, and unfortunately died because they felt they didn't have availability of healthcare provision, which is not the case in the UK. So it's always essential that you contact medical people for help as you normally would. So two potential reasons for that. Anyway, we know that 4,122 deaths registered in England and Wales involved COVID-19. Now, of that sample of 4,122, 2,523 were men, 1,599 were women. In other words, we can see that more men are dying. So 61% of the deaths were men, 39% of the deaths were women. So from this we can see, and we would expect this trend to continue, that more men are going to die than women from COVID-19. As of now, I don't know why this is, but it clearly is the case. And we would expect that to continue as well. So next month, or wherever you are, I would expect more men to be dying than women. I would expect these figures in New York or California aren't too far different from the ratios between men and women in the UK. And I think we've got a graphic that shows that. Yep. So on this graphic, we have the number of men dying in blue. Now this is for the same week. This is for the week for the 7 days up to the 3rd of April. So the 15 to 44 years of age group, unfortunately we still do some deaths. Again, very slightly more deaths in men than women. Very tragically young deaths in that age group. But we see the number of deaths increased in that week from the 45 to 64-year-old age group, and we see clearly more men are dying compared to women. Then the 65 to 74-year-old age group, again, many more men than women, but a total number of increased for the increased age. Then at the older age group, 75 to 84, again, we see an excess of men dying. But of course, we see many more cases in the 75 to 80-year-old age group than we would expect. And finally, in the older 85s, again, still more men dying than women. And here we see there was, this column here is 754 men, and that is 642 women. So again, we can see the increasing trend with increasing age. Now, the reason this probably doesn't continue like that is because by the time someone reached 85, a lot of people have died already. So there's less people in the demographic of the population at this time. Otherwise, we would expect that to go on increasing, but it's related to the total numbers in the population. So we've definitely got a trend line there with increasing age, and clearly more men than women are being affected. I'll come on to that one in a minute. So more men than women. Now age, and again we've seen that clearly on the graphic we just looked at. The majority of deaths are 65 years of age and over. 3,588 deaths out of 4,122 were over the age of 65. So what we're seeing is 87% of the deaths that did occur were older than 65. And again, this is confirming data we'd speculated about for a long time, but again, this is based on a pretty large sample size. So I'm pretty confident that these figures aren't going to change too dramatically now, basically wherever you are in the world and ongoing into the future in my country. So 87% were over the age of 65. But of course that means that 13% of deaths were in younger age groups. So 13% of deaths were under the age of 65. So I suspect when we're looking back in a year's time and we've got, unfortunately, many more deaths to be able to analyse, we'll probably see similar ratios to this. I would expect this is what we're going to get now. And 34% of the total were over the age of 85. Quite a high percentage, but of course there's less people to die at that age because some of them have died already. But I think we've been speculating for a long time about what these figures are, and now they're starting to firm up. So I'm fairly confident that we're going to get things in that kind of range wherever we look in the world, and whether we're looking this month, next month, or indeed the month after. Now, number of deaths overall. England and Wales the week ending the 3rd of April. Again, we've mentioned that for this. In fact, we've done this. An increase of 5,000 compared with the previous week. Over 6,000 more than the 5-year average. This is interesting. We didn't mention this before. So just that bit, we see that there's, in the week up to the 3rd of April, there was 6,000 more deaths than we would normally expect on the 5-year average. But in London for that week, nearly half of all the deaths reported in London were due to or associated with COVID-19. So in the week ending the 3rd of April, 46.6% of all deaths in London involved COVID-19, because London is at a more advanced stage. They are ahead. Their curve is ahead. So in other words, what we've seen, if we imagine that this is the curve for London, well, we've seen that go up, and we're kind of there now. If that's today, it's gone up, the deaths. And where I live, we're a bit behind that, or many other areas are a bit behind that. So this would be time here. So our curve might be a similar shape, but just occurring later on. Actually, we hope it's not going to be a similar shape, because we hope the lockdown measures are going to take effect and bring it down all the sooner. But in London, they were ahead. There was more cases at an earlier stage in London. So that's up to the week. 46.6% of all deaths in London up to the week ending the 3rd of April. When we get the data shortly for the week ending the 10th of April, I would expect that to go well over 50%. And of course, this number to be significantly higher. So let's have a look at this graphic now that I've just put up. So this is number of deaths registered by week. England and Wales. This is the 29th of December to the 3rd of April. So this is over a longer time period. But this is over the epidemiological year. So that will be the 1st of January there, or the 29th of December anyway. So that goes from there up to there. And what we see is all deaths are that blue line there, and all deaths on the 5-year average there. So we see that for some months, actually, deaths have been a little bit below average. Round about what we'd expect there in the peak influenza season. More people tend to die in winter, of course. But then what we see is this week, near the end of March, beginning of April, just there, then we see a sharp increase in all deaths there. And then when we look down here, we say that this grey line, so this red line is deaths from influenza and pneumonia, which of course we normally have. The blue line is influenza and pneumonia 5-year average. So we see we haven't done too bad this winter overall. But then we see the grey line here, the COVID deaths are increasing and will carry on increasing. And it's this grey line here that's caused the increase in that line there. So fairly definitive data there. Now, just to finish off, what people are worried about. People are worried about their own well-being. So what's causing anxiety around us is the question. People are worried about their own well-being. They're worried about the essentials of life, grocery and medication availability. And they're worried about their ability to make plans into the future, which I found interesting. I suppose we do need to try and like to know roughly what's going on about the future. And this was the graphic that's available from the Office for National Statistics on what people are worried about. So we see here the list of things that they're worried about. So I'll put the link to that, or you can freeze frame. So I'm not showing it to you, Anna. There we are. There we go. So here we see the graph. This is what they're worried about. Unable to make plans, worried about their travel, worried about work being affected, access to groceries, medications, life events being disrupted, weddings, funerals, relationships, household finances, schools, universities are being affected, transport is being affected. These are the things that are causing people anxiety. So I just thought that was interesting. Right, I think that's the essence of what I wanted to say today. What we are seeing is basically what we'd expected, and this is being confirmed now with hard data. So we're speaking with much more certainty because of what the Office for National Statistics has put out, and we'd expect it to be the same in your area as well. So let's finish on a few pictures just for a slightly lighter note. Now this is Celine, and Celine's been making masks, and she's been doing nice t-shirts. I am my brother's keeper. Please protect me. So this is the excellent idea that if Celine is infected and she's wearing the mask, then she's less likely to infect me. So she is my keeper. What a beautiful, I thought it was a beautiful thought. Thank you for that, Celine. And I certainly appreciate you protecting me. And then, do we have something else? Yes, we do. We have Bob, who wants us to stay back 6 feet. Delighted to see Bob is being so antisocial. 6 feet is 2 meters in Europe, and of course that is an absolute minimum, as Bob, I'm sure, would agree. So 9 feet would be even better. I'll leave it to you whether you want to follow that bit. Got another picture of Bob somewhere from the front. Where is he? There he is. There he is. There he is. 6 feet distance determines our existence. So that is from our phrase, 2 meters distance determines your existence. Bob's converted it into American, which of course used to be English. 6 feet distance determines our existence. So that's Bob Harris. Thank you for those, Bob. I do hope you do well with t-shirts. Maybe I'm missing a trick with t-shirts, you know. I'll have to look into that.